respiratory disease. This is Tyro, and actually Tyro looked much worse when he first came in, and Khaleesi, just, sloughing the lip and the nose and the tongue and all this nastiness. Body score of probably not even 1, and is looking better here and really great here. And it looks like it's on somebody's belly. I'm thinking that's a foot, so I can only imagine. As far as respiratory disease, I'm a big believer in weight. I don't think I've ever lost an animal that has been gaining weight. So, if you just gave me weights of an animal, especially the young ones, the puppies, I can almost tell you, who's failing just by looking at that value alone. So, to me, weights are critical, much more so than even temperature. If I have a temperature on a cat, 102, 104, 106, I'm going to get concerned about it. But if I've got a kitten that's gone from 1 ounce or 1 pound 6 ounces, and it's now 1 pound, and it's been 2 weeks, then I know that we better step in, intervene, and find out how we can make that pet thrive better. So monitoring temp, fluids, food and water, just like us, pretty basic, but it's not uncommon if I'm worried about them for me to put them on, just to put the orders down, sub-Q fluids for 3 days. Maybe I'll give them mirtazapine because I know that that's usually every 3 days too. Syringe feeding I might put down automatically, and then for me to recheck them on the 3rd day to see if we need to continue treatment as far as sub-Q fluids, or sometimes we'll check them daily. But again, I've got other people looking at them too, so it doesn't just fall upon me. I've got CVTs looking at them. I've got animal caregivers looking at them. So often are a variety of food. Sometimes they love the AD, sometimes, Evo, it just depends on just kind of opening up a whole big cans of food sometimes that we've been donated or that we have. Antibiotics, Doxy is the main one. Proviable, I'm pretty much a lover of any probiotic, whether it be, especially for respiratory or GI, but sometimes for just general health. Nebulize if they're pretty congested. Sometimes I think these Khaleesi cats need some type of pain relief. So sometimes, so I see a cat that maybe doesn't have oral ulcerations, but they're kind of swallowing hard a little bit. Sometimes I think Carafate might help. So again, just being open and looking at the pet and seeing what else we can do to help them along. Diagnostics, not done that often, but if I have a real chronic respiratory, I think that finding out what bug is there and if it's resistant to everything. And ringworm, we do treat. We've done as many as over 100 dips a day when we were in outbreak mode last summer, end of the summer. So we treat until we have a negative DTM at 21 days, or if they were positive, the initial was positive, then 2 negative DTM, so we'll continue treating them. And that usually means internally and externally. So internally is going to be itraconazole daily, and I know there's a protocol where you can kind of break it up, but we do the itraconazole daily with food. And lime sulfur dips, and we do that twice a week. Isolate, of course. We do a toothbrush method, and we also will pluck the individual hairs if we have cross or alopecia. So that's what we talked about, lime sulfur dips. Sometimes we're even proactive about that. If we're in outbreak mode and nobody's clinical, nobody has signs or anything, we'll go ahead and dip them just on intake. We haven't gotten to the point where we've needed to do that all the time, but especially during our outbreak mode. So again, it's treating this as a vital, living, dynamic being, and then adjusting your treatment depending on the conditions and the health of the shelter overall. Gastrointestinal, this is Toby. Toby, he was a sad case. It was one of those where it's like, oh, come on, how did we pull this dog? He was a puppy that was lateral recumbent, could hardly lift his head, extremely emaciated. I'm like, they're having a lot of confidence in our ability that we're pulling this one puppy that's near death, and his head looked like it was stuck in like a bus door or something, and just really lifeless, and really bounced back nicely, and just makes us a believer in what we do and wanting to take more and more challenges on. But we talked about monitoring of weight, again, even for GI. Fluids, food, again, that's pretty important. I use a lot of metronidazole. Antiemetics, unless I think I've got a foreign body, I stay away from the metoclopramides and things which increase peristalsis. But depending on the severity of, and sometimes IV fluids also with these. I do use a lot of Panicure, I do use a lot of Marquis for GI, and sometimes diet as far as ID or WD for the older cats or something, the fiber. Pain relief, again, I think that's something, these Panleuk kitties seem to be painful. If you're sloughing your gut, a little buprenorphine might not be a bad idea, just a small amount anyway. So some diagnostics, it's not uncommon if we've got a clinical case to run a Parvo test or a Giardia test, and especially a fecal, not to forget the basics. Panleukopenia we also treat, and we're pretty good about not spreading it. So sometimes it seems kind of scary that how could you do that depending on, everybody has different setups in their place, but sometimes you don't know until you try. But in teaching your staff as far as whether it be, we use a lot of those butcher gloves, they're pretty cheap as far as per cage, especially with some of this infectious. We use trifectin a lot, sometimes dilute bleach, made up daily. Treat aggressively, treat early. Supportive care is critical, again, food, nutrition. Euthanasia, we don't, if I have a parvo-positive kitten, I don't put the whole litter down. I don't even put that kitten down necessarily unless it's not responding to treatment. So euthanasia is reserved to those that aren't responding. The older the patient, we find that the chances of recovery, that's not too surprising. But we have had cats that might be 10 months old that die of panleukopenia, but it's definitely more the exception. And know your ability to successfully treat and to save a patient based on age. So if I have a 1-pound kitten that's vomiting or has bloody stool, and especially if I have another sign with it, like doesn't look like it wants to eat when I open up a can of AD or something, then I might be more inclined that pet is suffering, and probably our chances of pulling that kitten through probably is not reasonable. So sometimes we will, if we think the prognosis is poor to grave, then we don't put them through that.